Buenos días a todos. Vamos empezando ya con un poco de retraso, pero tengo aquí el placer a presentaros a Lowe del Supercomputación de Barcelona y una gran amiga de este años, y eso es un gran honor tenerte aquí y de la organización también. Ella misma es graduada en Meteorología y en Oceanografía. También tiene un máster en riesgos geofísicos y es doctora en matemáticas. Su línea de investigación principal son enfermedades infecciosas y el clima. Y justamente de estos servicios climáticos en enfermedades infecciosas nos va a hablar hoy. Y no quiero añadir nada más y dejar la palabra ya a Rachel.
Muchísimas gracias, Dominic, por la invitación. ¿No? Ah. Gracias. Pues es un placer estar aquí. Si no te importa, voy a presentar en inglés, pero cualquier pregunta en castellano, no hay problema. Okay, so I'm going to talk today about some work we've been doing looking at using climate services for health, thinking about how we can move from global observations to local interventions. Now, some of you probably are familiar with this visualization. This is by Ed Hawkins' team, converting the warming stripes compared to a 71 to 2000 average. And we can see that since the turn of the century, we're seeing a really dramatic level of warming of global temperatures. This, combined with increased international travel and trade and more extreme events, is impacting the distribution of infectious diseases around the globe. And the World Health Organization now estimates that around half the global population is at risk of mosquito-borne diseases like dengue. In the 1970s, there are 9 countries reporting outbreaks of dengue, and that number has now increased to over 120 countries and is spreading and increasing. We published an article last year which used climate change projections and socioeconomic pathways to show that the length of the transmission season and the population at risk of two of the most important mosquito-borne diseases, malaria and dengue, is increasing. And if warming is to continue as business as usual, by the end of the century, we could see an additional 4.7 billion people at risk of these diseases. Whereas if serious mitigation action is to be taken to keep global temperatures below 1 degree, which is already not looking likely, then that number would be dramatically reduced to 2.4 billion additional people. So as well as the warming temperatures allowing mosquitoes to establish themselves in new areas, in highlands and in higher latitudes, we're also seeing more unpredictable and extreme climatic events such as floods, droughts, cyclones, and this has implications for infectious diseases. We conducted a scoping review to look for evidence documenting outbreaks of infectious diseases following extreme climatic events. We found substantial evidence of outbreaks of waterborne disease such as diarrheal disease and cholera, particularly following cyclones and flooding. And we are seeing some emerging evidence of links between droughts and extreme rainfall and dengue. A couple of years ago, we laid out a paper with strategies to increase resilience, to strengthen the global response to climate change and infectious disease threats. And we identified a series of actions, including framing the problem with an interdisciplinary lens, so thinking about planetary health, thinking about One Health, how both humans and animals interact together to increase the risk of zoonotic spillovers, for example. We called for an increase in funding in climate and health, and since we published this paper, we have seen some positive movements in this direction. The Wellcome Trust, a charitable foundation in the UK, have started investing in climate and health. It's become one of their priority areas, along with infectious diseases and mental health. We also proposed increase take-up of environmental information into decision support systems and improve capacity to implement these kind of tools at the local level. So the goal of our work is to make use of all the global observations from satellites, reanalysis that are available to us, and to translate this information into something that really can be useful on the ground. And to do this, we have to find a way to harmonize data, these gridded data sets with locally collected surveillance data, for example, cases of disease, and to co-create with stakeholders who are actually planning to use this information to inform their decisions, tools that are actually user-friendly and sustainable. So this here is showing a map of the correlation between sea surface temperatures in the Pacific, positive sea surface temperatures indicative of El Nino, and precipitation. So we can see that during El Nino events, we tend to have anomalously wet conditions, particularly in the coastal area of Ecuador. And we were working with partners in the Ministry of Health in Ecuador to try and make use of this signal from El Nino and use it to predict the risk of dengue outbreaks. This is an image of the flooding event that happened in the city of Machala following one of the strongest El Nino events we have on record in 2016. And we can see that these kind of conditions expose the population to really dangerous conditions in terms of spread of mosquito and waterborne disease. So we were working, this was a collaboration between meteorologists, epidemiologists, and disease surveillance teams in Ecuador. We used historical data from 2000 to 2015 to develop a probabilistic dengue prediction model using meteorological station data within the city combined with El Nino indicators. And then at the start of 2016, we used an ensemble of seasonal climate forecasts predicting both precipitation and temperature, combined with an El Nino prediction model. And we were able to estimate that the peak in dengue in 2016 would have happened 3 months ahead of the expected peak based on the annual average cases over the previous 5 years. So we can see, so you can use, oh no, sorry. Yeah, so if you just using the average cases over 5 years, this is called the endemic channel, the peak would have been estimated in July, but using the climate forecast, the early peak was estimated and did in fact occur. And we were particularly lucky this year because El Nino meant that the seasonal climate forecast actually did a good job. And we can see in the plot on the left that the dashed black line is showing the actual observed conditions, which high precipitation, which coincided with the flooding event that I showed previously. So as well as working in Ecuador, we've been working with partners in the Caribbean to try and work towards developing climate services for health, working with the Caribbean Institute for Meteorology and Hydrology and the Caribbean Public Health Agency and local ministries of health. In particular, we've had a very fruitful collaboration with partners in the Ministry of Health and Wellness in Barbados. And we've developed a series of papers, a modelling study identifying links between hydrometeorological indicators and dengue. We've also conducted a series of interviews with stakeholders to identify needs and perceptions. We also laid out a framework to build resilience to mosquito-borne disease in the Caribbean and work with partners in the WHO to publish a report in the WMO Bulletin. So the Caribbean, along with many other places in Latin America, is now facing a crisis of epidemics of both dengue, chikungunya, and Zika viruses. Dengue has been established for several decades, but chikungunya entered into the Caribbean for the first time in 2013, and the Zika virus began to circulate around Latin America from around 2015 and 16. So this new situation is very challenging to monitor, and we wanted to try and make use of the meteorological information available to try and predict the probability of outbreaks in advance. And our partners in Barbados had identified that they were starting to see a change in the dengue epidemiology, and that this perhaps was linked with drought events. And Barbados is one of the most water-scarce countries in the world and does experience particularly severe droughts linked to El Niño events. So we developed, we used the sort of Bayesian probabilistic modeling framework that we'd used in previous studies and combined this with distributed Lagrange linear models to be able to identify these delayed impacts of extreme events. And we can see here that as well as an increased risk of outbreaks immediately after exceptionally wet conditions, which is what one would expect, we also identified an increased risk 4 to 5 months following drought events. And this was an interesting finding that we were considering how we can start using this in our early warning system frameworks. So this was a proposal that we had to be able to produce forecasts monthly until the target month, so the peak month that the Ministry of Health were interested in, by using a combination of both observed climate information and forecast information, and updating this with observed data every month as you get closer to the target to improve the accuracy of your forecasts. So this work, this link between droughts, dengue, and extreme rainfall is now being used in a qualitative way within the Caribbean Health Climatic Bulletin. In 2020, there was a region-wide drought, and a warning based on the results of our paper were included within the bulletin to be prepared because following the drought event, there was a forecast for exceptionally warm and wet conditions. So this was just an example of how this work was helping to impact policy, but we still want to take this a step further and to be able to incorporate more quantitative information into these bulletins. This is an example of a framework that we have put together with partners in Vietnam. Thanks to a UK Space Agency funded project, we are working with HR Wallingford, a hydrological company in the UK, and the Met Office. And at the London School of Hygiene and Tropical Medicine, we developed a dengue modelling framework using a model super ensemble, and this incorporated different measures of the climate, including diurnal temperature range, wind, sea surface temperatures. We combine this with information from a hydrometeorological model, and then using seasonal climate forecasts, an ensemble of 42 members from 1 to 6 months in advance, we produced probabilistic dengue forecasts. And this information was incorporated into a platform which is accessible just to the to the Ministry of Health in Vietnam. And this platform displays the probability of outbreaks of a certain level of risk of dengue across the different provinces, and also predicts the evolution of the season several months in advance. So this has been a very interesting project and has won several awards. So we've been doing work in Brazil to try and understand how dengue is spreading to new areas. So previous studies identified these geographical barriers to dengue diffusion, particularly mountain ranges or cool temperatures that prevented the mosquito to be established, for example, in the south of Brazil, and also very remote protected areas. These were sort of areas that were previously protected from dengue, but we're seeing that over the last 10 years, dengue is starting to spread into the south of Brazil. Just this year, parts of the south experienced some of the worst epidemics with several deaths related to dengue fever. And also in the Amazon region, we're starting to see the dengue spreading into the rainforest, as we're calling the urbanized rainforest. So both due to warming of temperatures and increased connectivity and human mobility, we're starting to see dengue spread even across Brazil. And this is just showing the change in connectivity from 2007, if we consider, for example, Manaus in the Amazon. That city is now much more connected with much smaller places in the Amazon and to other places across the Brazilian network. And this connectivity allows dengue to spread from areas where it's been endemic for several years into these new areas with no immune population. So we can see here, this is an image of one of the largest favelas in the city of Rio de Janeiro. So unplanned urbanization and inadequate infrastructure is also contributing to these explosive epidemics of dengue. You might be able to see several sort of blue patches on this image, and they are temporary water storage containers which are relied upon particularly in times of water shortage or extreme events. And this kind of environment just provides the perfect storm for these explosive epidemics. This is an example of the sort of water storage container which is implemented. This is a square in a northeastern city of Brazil, and then this is a photo of inside the container, and we can see that it already has become a mosquito breeding site. So this is just the mechanism by which drought events which force temporary water storage can lead to additional breeding sites, which can then increase the risk of dengue several months later. So following our work in Barbados, we wanted to understand if what we found there was also relevant in the Brazilian setting. So looking at a much larger, diverse geographical setting with plenty of high-quality dengue data. So we were using dengue case data for all the 558 microregions across Brazil, from 2001 to 2019. Here we've just aggregated the data to the state level. There are 27 states across Brazil, and they're organized geographically more or less in the shape of Brazil. And then we also extracted the Palmer Drought Severity Index, and we can see that we're seeing much more extreme droughts, particularly in the north and northeast of the country in the last 5 years. So we wanted to understand how drought conditions might impact dengue, both in urban and rural settings. So we also wanted to incorporate into our model level of urbanization and things like access to the pipe water and water shortage frequency. So we incorporated into our model the links between temperature and dengue, and as expected, if we have warming temperatures, then 2 to 4 months later, we can expect an increase in dengue outbreaks, and we found that minimum temperature was a particularly important indicator. Maximum temperature as well helped us capture, those times when it gets too hot. Sometimes we can have conditions are too hot for the mosquito, and we see less dengue. But here, minimum temperature was a better predictor. And interestingly, we found a very similar pattern that we found in Barbados, with this increased risk of dengue 4 months following drought events. And this effect was exacerbated in urban areas compared to rural areas. In the rural areas, for example, in the Amazon, then the link with the extremely wet conditions was more relevant. And this information helps us tailor the kind of warnings we might give depending on the geographical setting. So this is an example of one of the first real-time dengue forecast using seasonal climate forecast information. This was published in 2014. We put this together with the Ministry of Health because they wanted to understand what would be happening with the risk of dengue during the 2014 World Cup. During my PhD research, I developed a model framework to predict the risk of dengue with partners in CPTEC in Brazil, in Fiocruz. And so once, several years later, when this situation came up with the need to make a prediction, we were ready with our model framework. And so we used the seasonal climate forecasts issued in February, valid for the March, April, May season, with the observed dengue cases at the time of forecast to produce a probabilistic risk map to show the probability of outbreaks of either high, medium, or low risk of dengue. And we can see that there was pockets of the northeast where several of the stadiums were located, where the risk of dengue was substantially higher for this time of year, which was not the peak dengue season. So it's important to think about when a model informed by seasonal climate forecasts might be useful. We know that El Niño events tend to produce more skillful seasonal climate forecasts. This here is showing the correlation between sea surface temperatures, so the oceanic Niño index, and drought conditions on the left and temperature on the right. So we can see that in the northeast, for example, El Niño tends to result in droughts, whereas it tends to result in extremely wet conditions in the south, for example. So we can try and use this kind of information to pinpoint those places in Brazil or anywhere we're working that may have more skillful forecasts, and to communicate the past skill of the model to the users to manage expectations. This is just a schematic laying out how we may want to focus more, for example, on droughts in urban areas in advance and extremely wet conditions in rural areas, and thinking about using this information to help disease control teams tailor when they begin their interventions. So typically in Brazil, the interventions begin in October and end in May, and whereas using this kind of information can help adjust those schedules. So I recently joined the Barcelona Supercomputing Centre, and this has been a fantastic opportunity to be able to combine the infectious disease epidemiological models that we've been developing with high-quality climate information, and also working with knowledge transfer experts. So I've established a new group, the Global Health Resilience Team, in the Earth System Services group, which is led by Albert Soret, who presented yesterday. And we are working alongside experts in air quality services, climate services, and knowledge integration. And we've developed a series of projects and proposals to try and take the work we're doing forward and really try and have the chance to be able to implement this in a user-friendly format. So we were recently granted a climate-sensitive infectious disease modelling tools grant from the Wellcome Trust. And here we aim to develop hopefully a user-friendly R package to be incorporated within the current R tools infrastructure at the BSc. So there are a series of tools that have been developed to process climate information, produce climate indicators, for example, and then we want to build a tool that will be able to incorporate these indicators, for example, looking at the standardized precipitation index and other temperature indicators, for example, and bring this within a tool that can help us look at the compound and interactions of these and how they impact disease risk, both outbreaks of dengue, cholera, malaria, and any other climate-sensitive disease. And to develop this with partners, particularly we're working with the Red Cross, we're working with Médecins Sans Frontières, and with a dengue forecasting platform called InfoDengue in Brazil, as well as our partners in Barbados. So the idea here is to produce a tool that will provide meaningful information that can be incorporated into platforms to produce this kind of information in advance. And we're also looking both with our project and with all the other projects funded in this call to look towards developing a community of practice in climate-sensitive disease modelling tools, and thinking about how we can interact both at the technical level and with users of the tool. So this is a schematic of the kind of thing we want our tool to be able to capture. So speaking with our users, we found that this concept of using the distributed lag nonlinear models, where you have to rely on multiple lags and leads to inform your model, is actually it's quite demanding for the users to be able to provide all that information. So we're trying to simplify our framework and identify which interacting long and short lag indicators are most important. And using this model, we found that, for example, if we are to have hot and dry conditions, and then several months later we have a forecast of wet conditions, then the model provides a high risk of a dengue outbreak. Whereas if we see cool and dry conditions, and then it continues to be dry in the next season, then the model would produce a low risk of dengue outbreaks. So we're trying to work with our partners and think about how we can display this information. This is a prototype that was mocked up by the Barbados Meteorological Services. They already have a platform when they're producing forecasts, for example, of dust haze and many other sort of climate services, and they're very keen to work with us to incorporate a dengue risk forecast for Barbados. And we're thinking about using this impact matrix that was designed by the World Meteorological Organization to try and communicate those different levels of risk of dengue given these interacting climate indicators. Part of our project will also be to develop training courses like one that we gave a couple of years ago in collaboration with the Red Cross, So this was a training course on impact-based forecasting for predicting arbovirus disease risk in small island developing states. And we're working to develop more of these training materials for local users. So another digital foundation project we're working on, funded by the Red Cross, is a project called Harmonise, where we're looking to harmonise multi-scale spatiotemporal data for health in climate change hotspots. And we're particularly working with partners in Brazil, Peru, Colombia, and the Dominican Republic to be able to build toolkits to harmonise different kinds of data, including satellite and gridded products, strategically collected drone images, and weather sensors that we're going to implement in certain places, along with socioeconomic and demographic data and disease surveillance data. And we want to develop these toolkits for specific hotspots, particularly in cities, in the Amazon rainforest, in the Andes mountain range, and also in small islands in the Dominican Republic. So one of the reasons we think it's important to do this is because we can only produce effective models if we have robust, reliable data sets to go through them. So this is an example that we did to test the importance of the kind of climate product you use to determine associations between disease risk and climate indicators. So here we're on the left, we can see this is a dengue model for Machala, similar to the prediction I showed you earlier for Ecuador. So we can see here that if we are to inform our model using meteorological station data in the place where the disease transmission is happening, we see an association for example, a 1 degree increase in temperature would result in a 68% more chance of dengue outbreaks. Whereas if we were to use one of the gridded products, it's a 40% increase in risk. So we can see that depending on the product, you could end up with very different answers. And when we tested this for malaria in the same province in Ecuador, we found that one product gave a positive association between rainfall and malaria, whereas another product gave a negative association. So this shows the dangers of users just taking this information off the shelf and plugging it into a model. So we're hoping to use the Harmonise project to be able to conduct downscaling and bias correction to really produce information at the local level, and also to improve, develop artificial intelligence algorithms between these large-scale satellite images and then our strategically collected drone data. This is an image of Loreto in Peru. So we can see from this kind of image, we can identify the ways people may change water storage, for example, following extreme events, and how water availability may impact different breeding sites. Oh, sorry, don't know what happened there. Okay, you still with me? Okay. So I'm going to just shift gear a little bit and talk about our Lancet Countdown project. So I think you may have heard Claudia presented about the Lancet Countdown project yesterday and the work that's been done in the Impacts Working Group. So last year we launched the Lancet Countdown on Health and Climate Change in Europe. So this is a new collaboration looking to really focus on the European region and develop policy-relevant local indicators for decision makers, particularly the European Environment Agency and users of the European Climate and Health Observatory. So briefly, the Lancet Countdown is a collaboration of over 100 researchers worldwide, developing indicators across several different sectors, from impacts, adaptation, mitigation, economics and finance, and political engagement. And the first indicator report was published in 2015, and there's been a report published ever since. The 2022 report will be published next week, and there will be a launch event on the 26th of October. So briefly, the framework is to look at progress or lack thereof on the impacts of climate change on health. So we're looking at hazards, exposure, and vulnerability. We're also looking at different adaptation measures which are taken to adapt to the changing climate. and also tracking ways that governments are implementing mitigation actions and also the health benefits of those mitigation. For example, what the health benefits of shifting to more active forms of transport or changes in diet. And we're also monitoring the economic implications of shifting towards a more carbon neutral society, and also monitoring the political and social engagement with climate and health. So the collaboration has been growing substantially. We now have regional centres in Australia, South America, in Asia, in Africa and small island developing states. I'm the director of the Lancet Countdown in Europe. So this is our core team. So I'm leading from the Barcelona Supercomputing Centre, and we also recently have a co-director who's joined us, Catherine Tonne from IS Global. We have chairs based in Umeå University in Sweden, in IS Global, and we have working group leads who are experts across these different sectors. And we're also working with Marina Romanello, who's the executive director of the Global Lancet Countdown team. So we have currently 44 authors based across 29 different institutions. And we're working particularly with the European Climate and Health Observatory to produce information for different partners, including the World Health Organization in Europe and the ECDC. And this platform makes use of information from many different services across Europe, including Copernicus and the Lancet Countdown. We're particularly developing indicators for the platform. Here is just an example of an indicator on population-weighted green space, changes in arboviral diseases, for example. This year, we've been publishing or preparing our first indicator report, and 10 of our indicators have been incorporated into a policy report that will be launched by the Environment Agency on the 9th of November. And in this report, we include indicators, for example, on extreme heat. We also have an indicator on West Nile virus risk, on dengue risk, and on malaria. These are all based on using climate indicators to understand how the climate suitability for these diseases is changing across different regions in Europe, and we're seeing a generally increasing trend for all of these pathogens. The European Union has just funded a new climate and health cluster within Horizon Europe. So this cluster comprises 6 different projects which are working to develop indicators and early warning systems for climate and health across many different domains. And the goal of the cluster is to be able to harmonize and strategically develop together data management plans, policy strategies, and also communication dissemination tools. So this is the list of the different projects. There's a project called Blue Adapt, which is looking to reduce climate-based health risks in blue environments, focusing on monitoring pathogens in oceans. The Catalyze, this is a project that I am involved in through the Lancet Countdown, which is looking to develop early warning systems and indicators, for example, for pollen, for heat-related mortality. There's also a project called Climos, which is looking particularly to develop decision support systems for sandfly-borne diseases. High Horizons, which is looking to develop early warning systems, particularly for pregnant postpartum women, infants, young children, and health workers. ID Alert, this is a project led by Umeå University and co-led by us at the BSc, which is looking to develop infectious disease decision support systems to build climate resilience to emerging health threats. And then there's another project called Trigger as well. So in terms of the Lancet Countdown, we are partially supported by these 2 projects, ID Alert and Catalyze. We're looking for opportunities to collaborate with other projects to be able to secure that core funding to be able to operate the Lancet Countdown in Europe. And these projects will also be providing high quality evidence to inform our reports. So I'll just say a little bit about the ID Alert project, which I'm involved in. Our concept is to try and incorporate both the IPCC framing of risk in terms of exposure, vulnerability and hazard with the One Health approach of monitoring animal, environment and human health so we can bring all this information together with our sort of interdisciplinary team to develop these both regional and local decision support tools. So we'll be looking to develop both indicators tracking the impacts of climate and environmental change on disease risk. We're looking to develop sub-seasonal to seasonal predictions of the risk of certain pathogens across Europe. And we're also looking to combine this information with novel data streams such as citizen science and smart trap data to inform decision makers in our hotspot areas. We're working in Catalonia, in Greece, in the Netherlands, in Sweden, and also with partners in Bangladesh. So the goal is to develop both tools at the sort of pan-European level and also in these climate change hotspots. So we're working, for example, with users in the Red Cross to support populations on the move, for example, and also with travel agencies like IATA to understand how travel, both in terms of for work and leisure and tourism, but also in terms of migration, might be impacted by the changing climate and infectious disease risk. We recently were awarded another project which will start in January. And this project is, this was off the back of an epidemic early warning prize call that was issued by the Commission last year. And the dengue early warning system framework that I showed you for Vietnam, that project was one of the runners-up of the prize. And so between our team and another team based in Barcelona, who have a platform called Mosquito Alert, to be able to use citizen science to monitor the emergence and spread of particularly the tiger mosquito. We put these two tools together and we were awarded this project to develop eco-epidemiological intelligence for early warning and response to mosquito-borne diseases, both in endemic settings, such as in Brazil and Vietnam, but also in emerging settings, for example, in Spain, in Italy, where we're seeing more and more localized outbreaks of these diseases, both related to international travel and the warming temperatures. So this is just, if you'd like to learn more about these projects, we have some news stories on the BSc website about Harmonise and ID Alert. We'll also be having a new position coming up soon to help us develop all these tools. If you'd like to learn more about the work in general, we have the Royal Society produced a short video about our research, which also features partners at the BSc. And please register for our virtual launch event of the Lancet Countdown Europe. It's our first report, and we will be presenting the findings of the report and have a panel discussion on the 27th of October, so next Thursday. So please do follow us. If you'd like to learn more about that collaboration, you can follow us on Twitter at LCD Europe. So thank you so much for your attention. I'll welcome any questions.
¿Hay preguntas? Ya se nota que es temprano, ¿no? ¿Alguna?
Buenos días, buenos días. Felicitar a Raquel por la magnífica conferencia y simplemente, más que preguntas, reflexionar sobre aquel 2009, hace ya 13 años, que apareció en The Lancet esa frase clave de que el cambio climático es la amenaza para la salud global más importante a la que nos enfrentábamos. Yo no conocí, porque no consultaba The Lancet, no conocí esta frase hasta hace pocos años, pero me pareció fundamental. Es verdad que en la propia revista, Raquel, hubo debate, ¿verdad? Posteriormente hubo quien cuestionó esa frase, pero creo que ha sido clave. Luego, la importancia del concepto de Global Health, de salud global, ¿no? Nuestros estudiantes tendrían que aprender que no solamente es nuestra salud, la humana, sino también la de los animales y la del sistema natural. Y, por último, la importancia que ha dado a la ciencia ciudadana, ¿verdad? No solamente porque nuestros conciudadanos pueden aportar informaciones muy valiosas, sino también porque al final son sujetos de nuestras mejoras de investigación, y al mismo tiempo también la ciencia ciudadana sirve para concienciar a la población, ¿no? A nuestros conciudadanos. Por lo tanto, es simplemente esta reflexión matutina, ¿no? Felicidades por la conferencia.
Muchísimas gracias. No, sí, gracias por comentar. La frase del Lancet. Ahora mismo hay un debate de quién lo dijo primero, el Lancet o la Organización Mundial de la Salud. Sí, porque es clave.
Hola, buenos días, Rachel. Gracias por la presentación, me ha gustado mucho. Yo trabajo muchos años en temas de sequía, entonces especialmente me ha interesado lo que has hablado en particular de Brasil y en la zona del Caribe, el tema de cómo la sequía puede estar correlacionada con los outbreaks de dengue, ¿no? Has mencionado una parte y decías que era diferente en zonas urbanas y en zonas rurales, ¿no? El forecast de la epidemia de dengue, ¿no? ¿Cuál es la razón porque en las zonas urbanas, has dicho que ocurría antes, ¿verdad?
Sí.
¿Cuál es la razón por detrás de eso? O sea,
Sí.
¿habéis podido identificar?
Sí, también hemos estudiado con el indicador de urbanización, pero también encontramos una base de datos con los informes de falta de agua, water shortages, y durante las sequías, porque el nivel de agua baja tanto, luego hay muchas casas que no reciben agua. Entonces, incluso en las casas de alto nivel económico, tienen que guardar agua. Y por eso, yo creo que creemos que es asociado con esto, con the water shortage.
Okay. Una pregunta solo más y paso a los colegas. El tema de estos proyectos que has hablado, de Alert y Catalyze, creo, ¿no? Has hablado que van a estudiar también otros patógenos. ¿Son solamente vector-borne diseases o hay otro tipo de enfermedades que estáis considerando?
Sí, estamos también, sí, sobre todo los vectores, por ejemplo, garrapatas y mosquitos, Lyme, tick-borne encephalitis, dengue, malaria, West Nile, también leptospirosis, leishmaniasis, hay otras enfermedades y, por ejemplo, con el CLIMOS, el proyecto CLIMOS, pensamos hacer una colaboración para ese tipo de... Pero sí, interesamos mucho el leptospirosis porque está muy vinculado con las inundaciones.
Gracias.
Hi, Rachel. Thank you very much, for your presentation. I really enjoyed, especially the fact that I think you showed not only your studies, but also how you translated that successfully in something that is operational, in something that is really used by, whether it's forecasters or, public health agency. So I was wondering whether you have any lessons you'd like to share, how to make exactly this transition successful based on your experience. Thank you.
Thanks, yeah. I think probably the most important thing is before starting to develop this kind of model, having those conversations, like really going through the co-creation process. So even through the pandemic, we were limited to having to meet online, but I remember having this really fantastic Zoom where it was me and the meteorological, the leader of the meteorological services and the Ministry of Health and Wellness, and just having that conversation, it was just incredibly useful, the three of us sort of, an impact modeler, a meteorologist and a epidemiologist, just be able to speak together and find out really what is it we want to predict, what are the inputs that are available to make that kind of prediction, and how can we sort of validate it, and really about managing expectations as well. There's only so much you can do with climate information when it comes to health, because health is impacted by so many other things, sort of socioeconomic variables, dynamics like immunity. So really just making it clear that any prediction you put out, this is a risk based on these climatic conditions, but there are so many other things that can also impact that. So I think managing expectations and aligning vocabulary as well is very important.
Hola Rachel, muchas gracias por ponernos al día con todas estas cuestiones. Durante muchos años desde el marco mundial de servicios climáticos se ve que se ha evolucionado en gran medida. Mi pregunta va más en lo que acabas de mencionar, en la complejidad de estos estudios. Has mencionado Ecuador y recientemente hemos leído una tesis doctoral de un profesor de Ecuador, de una universidad allá, que ha trabajado en la cuenca alta del Amazonas, en una reserva biológica, y ha puesto de manifiesto que los cambios de uso del suelo en esa zona, por ejemplo, con comunidades muy pequeñas, tribales, han sido muy importantes en la presencia de un tipo de vectores u otro tipo de vectores. Incluso las técnicas de uso del suelo en agricultura, o si tenían agricultura y ganadería, esas comunidades, incidían en la probabilidad de la presencia de algunos mosquitos que tenían parásitos más peligrosos o menos. Yo no sé hasta qué punto este elemento se puede ir incorporando también a estos modelos predictivos, como un factor más añadido a las cuestiones climáticas, ¿no? Porque en esta zona tampoco disponíamos de mediciones específicas ni de temperatura ni de humedad, pero sí se ha visto que las transiciones de los usos del suelo a lo largo de 60 años inciden en la probabilidad de la presencia de un vector o de otro. Incluso las técnicas ya casi antropológicas de cultivo eran importantes en que apareciera un vector o no apareciera.
Yeah, I think this local knowledge is absolutely essential, you know, to be able to understand the local context and those peculiarities, and that can help us identify the kind of information that's missing from our models. So when we lack data, we tend to use these sort of random effects in our model, and sometimes we use those random effects and we analyse their shape to try and identify what might be missing. You know, if you see there's a particular anomalous random condition, a particular year, then we can go back and say what actually happened that year, you know, what data sets are we missing? And through the Harmonise project, we're trying to piece together all these different components, all the different types of data, so that users can, you know, analyse the part of the problem that's most interesting for their problem. So we're hoping to piece together at different sort of cascading spatiotemporal scales, both data about climatic conditions, land use and land type, socioeconomic conditions, to try and piece together all these things and build these sort of detailed, robust data sets.
En la presentación has mostrado varios sistemas operacionales, ¿vale? para dar información y poder llevar a la toma de decisiones. Y mi pregunta era cómo esta toma de decisiones se toma después. Porque, por ejemplo, estaba pensando en el caso de los Olympic Games que has mostrado en Brasil, que has dicho que debido al incremento de movilidad pues había zonas que eran más potencialmente que salieran enfermedades y tal. Entonces, ¿qué tipo de medidas toman los gestores de salud? Sí, entiendo que limitar la movilidad no puedes, pero ¿qué tipo de soluciones aportan, yo que sé, para el tema de la gestión de los reservos de agua o cómo se hace?
Sí, por ejemplo, en Brasil hay las zonas que están considerados endémicos para el dengue y hay como medidas muy claras para eliminar el mosquito, para dar información educativa a la población para protegerse. Y, por ejemplo, en zonas del sur seguramente no había este tipo de intervención porque no había el mosquito antes, pero ahora está apareciendo el mosquito. Y también, por ejemplo, en las Amazonas están acostumbrados a tratar a la malaria, y porque dengue es más una enfermedad urbana, pero ahora cada vez que el Amazonas es más conectado, está más urbanizado, así que de un lado los médicos tienen que saber que hay que reconocer o hacer las pruebas para nuevas enfermedades como el dengue, que antes no había en las Amazonas, pero ahora, por ejemplo, es para saber identificar bien qué enfermedad puede estar circulando y además eliminar este vector.
Gracias. ¿Más preguntas? Sí.
Buenos días y muchas gracias por la interesantísima presentación. Yo quería hacer dos preguntas. Una en relación también a los servicios climáticos de los health services. Sí, también me parece importante que a la hora de obtener esas necesidades locales, ¿no? Esos que tú decías tan importantes para contextualizar, si se ponen en marcha también, digamos, protocolos a la hora de los interviews, ¿no? Con los local stakeholders and so, para poder también armonizar las necesidades tanto de la información global que requieren para conectarla con la información local, como viceversa, es decir, que los propios agentes locales puedan saber cuáles son las informaciones claves que en un momento dado tienen que producir para poder conectar la información local con lo global. Y en eso me preguntaba si no existirían, lo digo por curiosidad propia para los agentes locales cercanos, si no existen también como protocolos orientativos que conecten esos datos globales con locales a la hora de poder abordar iniciativas de ese tipo. No sé si me he explicado bien, porque aunque sea un proceso, digamos, de interview, ¿no?, con ellos, yo me pregunto si tuviera que hacer eso, yo que no soy una experta, me gustaría poder tener algún protocolo, digamos, de modelo para que precisamente esas interviews pudieran ser útiles en ambos sentidos, producidas por alguien que no es un experto como vosotros, ¿no? Eso por un lado. Y en segundo lugar, me gustaría saber, porque yo, bueno, he trabajado con personas que se dedican al estudio histórico de malaria en España y nosotros tenemos datos de la guerra civil, del norte de Marruecos y, bueno, coordinamos un issue también on diseases, on infectious diseases y para nosotros era muy difícil poder conectar esos datos históricos de malaria, de la guerra civil, de cómo con los centros de atención en aquel momento, hasta que se consideró erradicada en España la malaria, con, digamos, el poder unir esos datos históricos que hemos trabajado con el presente, teniendo en cuenta ese salto temporal y la complejidad de diferenciar la transmisión por movimientos, por transporte, digamos, por las nuevas variables que condicionan con esos datos históricos. Y no sé si ahí me podrías ayudar un poquito. Gracias.
Gracias. Entonces, tu consejo es en el momento de hacer las entrevistas con los users también entender los datos que podrían contribuir? ¿O?
No, I was wondering whether if you know like the local data requirements in order to use them for the local actors, for the local stakeholders, what if there's any kind of protocol somehow to suggest them which ones or how should be the local information settled in order to match somehow with the local data and vice versa.
Yeah, so that's really what we're trying to develop right now in the Harmonise project, because as far as I'm aware, I don't think there are clear guidelines to be able to translate these sort of large-scale gridded products, or even when you're just working with different scales. Like often the disease surveillance data, by the time we get it, it's usually been aggregated to administrative units. So to be able to sort of make those decisions within sort of small districts or municipalities. So yes, that's something we're working on, because it's not necessarily straightforward to translate these gridded products into administrative level. You know, is it a question of just taking an average, or do you need to do a population weighting, or do you need to consider the topography? So yeah, that's the sort of things that we're trying to explore in this, because we do believe it's going to be setting specific. So what you do in the highlands will be quite different to what you might have to do in a small island compared to what you might have to do in a very densely populated urban area. So the idea is to try and, as you say, it's a nice way of framing it, develop protocols of how to marry those sort of large-scale global data sets to the local context. So yes, that's something that we are trying to do now. And yeah, I'd be very happy to talk about malaria after.
Ok, no sé si hay más preguntas. Creo.
Un comentario solo en relación con esto. Hace poco, en una conferencia, se presentó un artículo que evaluaba los distintos planes de adaptación al cambio climático que están haciendo las ciudades en Europa, y parece ser que el tema de la salud estaba muy poco considerado. Había más de 160 planes evaluados y resultaba que uno de los aspectos que se consideraba muy poco era el tema de la salud. No sé hasta qué punto hay alguna guía, algo que pueda ayudar a los que desarrollan estos planes a nivel más local para que integren muchos más aspectos que las olas de calor, que parece ser que es lo único que en aquellos planes que se considera es lo único que se incluye. Entonces, no sé si tú nos puedes orientar un poquito, porque ahora vamos a comenzar, por ejemplo, el de Santander, pero es que había 100 y pico estudios de planes de ciudades europeas y la salud quedaba un poquito olvidada.
Yeah, that's a really good point, and it's sort of one of the key goals of the Lancet Countdown collaboration to really frame climate change as a health problem. So, you know, through different sort of policy briefings, and we're trying to do this. The collaboration is quite sort of international and tends to be more at the sort of national level, but I think it's really important, hopefully also through these new climate change and health projects, to really bring that sort of that awareness about. It's really important if you frame climate change as a health problem, also the public will understand it more. You know, it's not just about, you know, images of the poor polar bears not having anywhere to live in the Arctic, but it's also something that's affecting the health of everyone. You know, both people living in these sort of low and middle income countries, but also, you know, in the places which are emitting the most carbon, their populations are also suffering from, you know, poor air quality, rising sea level, these really awful floods that happen in Germany and cost, you know, millions and millions of euros in losses. So yeah, it's really, we do need to work harder to frame climate change as a health problem.
Muchas gracias, Rachel. Ya pasamos ahora a la sesión que tenemos aquí.